Hello everyone, my name is Brian Noodleman. I am an internal medicine PGY1 resident at Memorial Healthcare System in Pembroke Pines. Today I am presenting a rare case of Puffy tumor in an adult with paranasal osteoma and pachymeningitis. I did this along with my colleagues Dr. Valencia, student Dr. Cortez, Dr. Krishnaswamy, and our ID program director Dr. Poon. An introduction on Puffy. It's an uncommon and potentially fatal medical condition seen in children and adolescents. It's characterized by a subperiosteal abscess in the frontal region of the face. It's associated with frontal scalp swelling, headache, fever, nasal discharge, and tender frontal sinus. It's been hypothesized that it's due to anatomically underdeveloped frontal sinus and increased blood flow into pleural veins. This is why it's usually seen in children, as their sinuses are usually not fully developed until they're a little bit older. We present the case of a 63-year-old male with a past medical history of prediabetes and hypertension, who presented with about 3 days of severe right eye pain, swelling, and redness. On admission, vitals were stable except for mild hypertension. Physical exam was significant for severe right forehead and periorbital edema, along with chemosis, which you can see right here, figure 1. Labs in the ED showed elevated CRP and ESR, and normal lactic acid, and urine cultures and blood cultures were negative. CT of the orbits showed right orbital cellulitis and severe erosive paranasal disease with possible right frontal subgaleal abscess, as you can see in figure 2. We also, upon further questioning, found out that the patient had a daily inhalation of cocaine and crushed OxyContin, with his last use being the day before arriving to the ED. ENT, ID, ophthalmology, and neurosurgery were all consulted. Neurosurgery ordered an MRI of the brain, which showed pansinusitis with associated frontal bone osteomyelitis. It also showed subperiosteal phlegmon, periorbital cellulitis, and pachymeningitis. You can see that right here in figure 3. ID started the broad-spectrum cefepime, metronidazole, and vancomycin for post-septal cellulitis and frontal bone osteomyelitis. ENT evaluated the patient and determined that due to an osteoma, they would not be able to do surgical intervention, and none was necessary at the time. But if surgical intervention was necessary in the future, a rhinologist evaluation would be necessary due to the complexity of the anatomy. After a few days of hospitalization, the patient became much better. However, after about a week of antibiotics, the swelling and chemosis sort of returned. So we weren't sure why this happened, so we ordered a CT sinus. It showed large right frontal calcified osteoma, as I mentioned before, an improved size of the subgaleal abscess previously seen on MRI, and a stable subperiosteal abscess. So after continuing antibiotics, the swelling again began to dissipate, and the patient was discharged to SNF with IV antibiotic therapy through a PICC line, as he could not be discharged home due to previous drug use. So, PBT is typically seen in the pediatric population. However, in recent years, it's been increasing in prevalence in adults, with about 53% of cases in the adult population. There are a lot of risk factors. Most common risk factor is sinusitis infection. However, there are other risk factors that are a little more rare. In our patient, he has 2 of these. One is the intranasal drug use, which is associated with about 11.8% of adult cases. And the other is his osteoma, which is very rare, and it showed a significant occlusion of the right frontal sinus, which can cause buildup of bacteria and Puffy over time. So a unique aspect of our case is the extracranial complication of periorbital cellulitis was the primary clinical feature that co-occurred with intracranial complication of asymptomatic pachymeningitis. Pachymeningitis is usually only seen in cases of children, so this was very interesting in our case. Our aim with this presentation and this case is really to kind of highlight Puffy tumor and show that it can happen in adults, and it can happen with asymptomatic pachymeningitis. It can happen in those with chronic intranasal drug use, and additionally it can happen in those with abnormal anatomies of their frontal sinuses. So we hope to encourage extensive workup with MRI, rhinology evaluations, cultures, and broad-spectrum antibiotics in all of these patients. And I will elaborate on this further during my next presentation.